Hi, everyone. Welcome back to Arthritis at Home. I'm Cheryl Koehn. I'm with Arthritis Consumer Experts. I'm the host of today's episode of Arthritis at Home, and I'm absolutely overjoyed to be joined by Parkash Ragsdale. We have known each other actually for a number of years on both the not really the patient pharmacist end, but on the peer educator to health educator and professional educator end of things. Parkash, may I call you Parkash?
Oh, absolutely.
Okay.
Thanks, Cheryl.
Is a licensed pharmacist with over 25 years of combined experience in the academic arena, not for profit, corporate, regulatory, and primary care environments. So, in other words, you have seen your entire way around the pharmacist pharmacy Rubik's Cube, have learned to work all of those colors together over your 25-year career. And we're so happy to have you here with us today, Parkash.
Oh, thanks for having me here, Cheryl. This is
Yeah,
great.
yeah. We're here, as you know, to talk to you specifically today about the flu and about the flu vaccine specifically. As you know, Parkash, pharmacists are some of the most trusted members of a patient's healthcare team. And I know that brings a smile to your face, and it actually brings a smile to my face to say it, because in fact, that's true for my own relationship or view of my own pharmacist in my life with rheumatoid arthritis. And the topic of flu vaccines is always one of interest to our membership, to our viewership. And so we wanted to pick your expert brain and to hear firsthand from you as we now are officially in not just COVID season, but
Mhm.
flu season. And it does present a whole other layer of information provision, I'm sure, on the part of pharmacists to pay to their patients, but also has piqued the interest seasonally of our membership. So really happy to have you with us to talk to us about this. So walk us through what exactly a flu vaccine does and how it helps to protect us from getting sick. So that's the sort of 101 question of flu
Oh,
vaccine.
yeah, for sure. The flu vaccine is protecting us against influenza viruses, in particular, influenza A and B viruses. And as soon as you get that flu vaccine, Cheryl, the antibodies start to build right away in your body. But it does take up to 2 weeks for the antibodies to fully develop and protect you against these uh, influenza viruses. You know, uh, especially during this flu season. And I do want to just mention that, before flu starts to spread and really peak in during this season, it's important for people with RA to get vaccinated, as quick as possible here.
Yeah, absolutely. And in fact, I know that you're situated in British Columbia, Parkash, and I think this is true across the country. In British Columbia, if you are immunocompromised, if you're over the age of, I think it's 65, there is a list of people who are kind of classified into a vulnerable for flu population, and then it is freely available to those people in the public. Is that correct?
Oh, absolutely. So if you have RA, you really are high risk in terms of the complications that can happen with flu or COVID-19.
Yeah.
And so it's important it's free for you, but it's also free for any household contacts that can spread it to you.
Right.
So they also, we know it's important for the people that are at high risk to get the vaccine, but anyone that can spread it to people that are at high risk, they too are eligible for the free vaccine. So in general, in this day and age, it's pretty hard to really find a reason not to give someone the flu vaccine for free.
Right. And where we might have been a society that was a bit hesitant to get flu vaccine in the past, we're seeing a huge spike in demand, and we're going to get to that a little bit later in this conversation. But it reminds me to ask you, why specifically is it important for people who are immunocompromised? Like, what do we specifically need to know about this season's flu vaccine?
first of all, I think that the flu vaccine, people must wonder, why do we have to get it every single year?
Right.
So what happens is that every year, the flu vaccine is such that it's not a live vaccine. There is a live form of a flu vaccine, but in general, most of the flu vaccines are not live vaccines. And so what happens is because it's not live, we have to, and because of the body that can basically mutate, these viruses can mutate in the body and they're really smart. We need to come up with new vaccines every single year for whatever the researchers predict in terms of what are those viruses that, we need to make sure that we protect people against. And so for people that are immunocompromised, they need to know that the flu vaccine is safe. They can get a flu vaccine that is not live. They're at low risk in terms of feeling that, somehow this flu vaccine can give them the flu.
Right.
And that to be reassured that they will not be receiving a live vaccine. It's
And
safe.
is a live vaccine just as safe and effective, or pardon me, a non-live, so I guess dead vaccine, for lack of a better way of putting it, are those just as effective, Parkash, as the live ones?
Yes, they're just as effective. The only difference is that a non-live vaccine, you have to get booster shots, or you have to have one every single year.
Okay, so, and that's why when the flu season rolls around, people like me who are immunocompromised, have a underlying health condition such as RA, needs to trot off to the pharmacy and get their vaccine. And just a note to our viewers: this year, because of the fact that flu vaccines are being delivered in a pandemic context, most pharmacies, if not all pharmacies, are setting up appointments this year. So rather than just wandering into the pharmacy and trying to get one, or waiting in line to get one, you're actually booking specific appointments.
Oh, absolutely. We cannot, we need to make sure, first of all, people that are at high risk get the flu vaccine as a priority over other people that are at lower risk. And plus, we don't want you to be in the pharmacy more than you need to be, because
Right.
there'll be other people there. So we want to really make sure that when you come in for your appointment, you're really, you're in there, you're safely administered the flu vaccine. The person is you have to fill out a screening questionnaire, which is really common. People are used to it now. You're doing it before you go into your, optometrist or your dentist.
Right.
And, we have to make sure that you're not coming in with any COVID-19 symptoms. And then we also want to ensure that the area where the flu shot is going to be given is disinfected, it's clean, the chair's clean, where we have the chance to, get all our masks on and make sure that we too are protected in our gear, and making sure that you're social distanced in terms of other people when you're getting this flu vaccine. So there's a lot of things that need to take place, unlike other seasons where you just walk in, and sometimes you can just get the flu shot without an appointment.
Yeah.
There's
Yeah,
a lot
that
of
was
things.
certainly my own experience at my pharmacy of choice, Parkash. And I'm proud to say I had mine last week. I made an appointment. They give you, interestingly, they'll give you the forms in advance. You can take them home and fill them all out. So that really all I did was walk up to the prescription drop-off counter, gave them the forms. I checked in for my appointment. They're staggering appointments far enough apart that the area that I went to had already been cleansed, had already been
Excellent.
disinfected. I went in and sat down. I might have waited 1 minute while the pharmacist put on their personal protective equipment, because behind the counters, they're behind plexiglass and they don't need to wear all of that. So I felt very safe going in and having it done. And then, of course, as I am wont to do, and a lot of people like me are wont to do, we had our shot and then we got the heck out of there and went home, washed our hands, did all the post outside world hygiene stuff.
Well, one of the things that, I just was also participating in giving flu shots this week.
Yeah.
And, the pharmacist will ask you to wait. And what happens is people feel like, I've had this flu shot before and I know I'm fine. I'm not going to react. But, it's so important that, and the pharmacists do tell you to wait. It's so important that you wait. And this year, it's usually 15, 20 minutes that we ask you to just either be in the waiting room or, somewhere in the pharmacy area, that should the rare chance that you get an anaphylactic reaction where, you have trouble breathing, you're breaking out in a rash, you're feeling like, it's harder to breathe.
Yeah.
We have the EpiPen, we have the epinephrine. It's a life-saving medication right there that we can administer on the spot.
Yeah.
Where if you take off, and you're driving or something happens, even though it's rare, we really want people to just hang out for, and this year we're asking people to at least stay for 10 minutes.
Yeah. I want to correct myself. So when I say got the heck out, I got the heck out after I waited in the magazine area for 10 minutes.
Yes.
So I got to catch up a little bit on some reading, courtesy of my local drugstore. And so thank you for raising that, because in my mind, that is just getting the heck out. But I did go and they did ask me to wait a minimum of 10 minutes.
Yes.
And I did. I'm a very compliant patient. And then I got the heck out. So
yes. Yeah, we don't want you to, we don't want you to be hanging out longer than you need to either.
Yeah.
But, just on that note, in general, like these side effects,
yeah.
Cheryl, you probably found, myself too, because I too got my shot this week. Sometimes with the flu vaccine, when we get the injection, like any injection, sometimes you have that little bit of soreness at the side. It can be red. And sometimes it might not show up till the next day. And we think, wow, I wasn't sore the day that I got my flu shot, but now I'm a little bit sore. People shouldn't be alarmed by it. It's, it's very mild side effects that can take place. And so just wanted to kind of remind people, don't be alarmed by soreness at the injection site, maybe a headache, sort of a low-grade headache. Some people say that they can get a fever, nausea, a little bit of muscle aches and fatigue, but these aren't that common. And but I do want people to know that these things can happen,
well,
but they're not severe.
Yeah. Thanks, Parkash, for reminding us. And especially, again, in the setting of a pandemic, you don't want to ignore those symptoms, because in fact, they're also COVID symptoms.
Yes.
Yeah. I'm one of the lucky ones. I experienced zero of those things. I don't even get a sore arm. But I think part of it is just, I've been on a therapy for my disease where I self-inject. So I'm not needle phobic. I'm not tense. I'm not uptight to get it. But I think that's an important list you've given everyone, and reassurance, which I think is a really good thing. Can you tell us, I'm now getting to the tricky part for you professionally. Talk to us about these shortages were starting. I mean, it was in the media earlier this week that patients in Ontario had made appointments, and then their appointments were canceled due to what I understood was a vaccine shortage. And I think you're going to bring a different perspective to this, or bring some additional information which will help our viewers understand what's going on.
Oh, for sure. I think, even before we have, this year's, special situation where we're dealing with the flu season and the COVID-19 that's taking place concurrently, just in general, when it comes to vaccines, it's the federal government's job to secure adequate supply of, like, let's say the flu vaccine and our COVID-19 vaccine for Canadians. And so and we were told, early on, we were told that, in terms of for Canadians, the government, the provinces, territories, that they ordered 22% more doses of the flu vaccine compared to last year.
Oh.
So, they anticipated this demand. It was happening in other countries. And so they ordered more. So we know that, we've been told that there's adequate supply. But we also know, as you're pointing out, there's a huge demand. And the way flu vaccine is made is it sort of gets released in batches.
Yeah.
So we know that we can have some, ebbs and flows with how, in terms of making sure that there's a smooth a supply that's being released. And that's always hard to predict. It's something that you're trying to use some past seasons and trying to think of the COVID situation. So in terms of having adequate supply, the federal government, the Public Health Agency of Canada has reassured us, yes, Canadians, we have enough supply of flu vaccine. And we also have heard Trudeau announcing that, making arrangements to secure COVID-19 vaccine for Canadians. But the piece that I want to really bring to everyone's attention is that how the vaccine is distributed to pharmacies. So this year, we know pharmacies are being relied on as the place to go. People have been encouraged. We have public health officers telling people, go get your flu shot.
Right.
And people are told, go to your pharmacy, make an appointment. And so pharmacies have been preparing for months, like since May, they're always having to prepare for this. But this year, they've been very proactive in booking appointments for patients, especially their priority patients, making sure that the PPE equipment is there, that they have, staff there to support them, because you have to have cleaners, you have to have people that can help
Yes.
make sure that people are screened. And so, and also pharmacy, the way we order our drugs in just when you go and get your drugs in the pharmacy, we have like the best in class of a distribution system when it comes to securing supply of drugs and making sure that pharmacies can get them. Pharmacies can get drugs the same day, sometimes twice on the same day when we use our distribution system. And what's so interesting is that public health isn't using our pharmacy distribution system to give us their vaccines. What
So
they're
you've got
doing,
this great system to
yes,
distribute in place and being used every day, multiple times a day, but yet it's not being used for vaccine distribution.
no. So what community pharmacies have to do in this very tough times of trying to do so many things with the flu, making sure they're prepared on their end, so that people have timely access to the flu vaccine. It's in a safe environment, screening people, hiring people, booking appointments. They have to get in their vehicle, bring a cooler, go to public health, wherever they're telling, and show up, and they have pre-ordered their vaccines. And there's cases where whatever they ordered, they don't even get what they ordered. And then they have to go back. And if they don't get what they ordered, it's not like someone told them ahead of time, oh, we won't be able to fulfill your total order. Then they come back, and if they don't have enough.
So that's why appointments are getting canceled.
Yes, or they're telling them that you can't come pick it up because we don't have the flu vaccine for you. So, and I think that this system of I can't speak as to how public health, what their system looks like. But, in all the years since this has been going on in British Columbia since 2010, it's been like, we're talking 10 years of pharmacies, people having to go with coolers to go pick up vaccine.
Yeah.
Let's get it to the pharmacy distribution centers. People can access this medication and, pharmacies can order it. They don't have to have excess supply. They can order based on the demand that's coming into their pharmacies, ordering it, and I just think that it's such an inefficient system. And in a time of COVID-19
Yeah.
and a flu season where we need people not to be turned away because we can't get timely access to the supply, whether it's because of the distribution system, even though we're sure there's enough supply, like what's going on here?
Yeah. So it sounds like you've got the right widget to fix the problem.
Oh,
but
yes.
you don't have a willing listener on the part of perhaps the federal government in how it is they've always done things before. And I know working in advocacy and volunteering in advocacy with or without professionals such as yourself, making this kind of change is really difficult. But when you do, the benefactors or the beneficiaries are patients, right? It means that everyone in the chain who's supposed to be serving the patient at the end of the day is going to be able to do it better and with less aggravation.
Well, it's true. And,
Yeah.
I think about, all the patients, that come in, and it's pretty amazing that you can come into pharmacies and in general, they have your medication,
Yeah.
like the inventory control and having enough supply. Like the only thing that we're always dealing with, which is we're just more and more of it, is drug shortages, which aren't in the control of pharmacies.
Yeah.
But in general, when do you walk into a pharmacy and not get your drug?
Touch wood. I've got a piece here. It's never happened to me, but it does happen to people, patients across the country and frankly around the world. And that feeling you must have at the counter when someone says, we don't have enough, like in the case of the vaccine currently, it's a scary thing. And for a lot of people, talking specifically about vaccines, sometimes, Parkash, people really have to talk themselves into getting it because perhaps ideologically they're not kind of completely convinced that they work. And so then to do all that, to make the appointment, to overcome that kind of hurdle internally, and then to have the appointment canceled is really not good.
No, and I think, I always look at things, what can we learn? Like
Yeah.
we need to get COVID-19 right. So, I think we have time to, if we've got a pharmacy distribution system, it works, let's tap in, let's support pharmacies, community pharmacies to help Canadians. I mean, it's just such
Yeah.
a simple solution.
Yeah.
And I think,
And the segue here is that if you can get this right, even in the immediate, short term, it does something for you to prepare for distribution of COVID-19 vaccine, which is really how we kind of wanted to end this conversation today.
yeah.
What are your thoughts about that? Do we have an efficient way and fair and equitable way of distributing vaccine in this country? And if not, how can we get there?
I really trust that people are getting together. I think people are collaborating behind the scenes. I think it's, everyone, what brings us together is it's making sure British Columbians, Canadians, all of us, we have to keep our country safe. And I believe in the Canadian way of doing things where I do look at, the times that we're in. I don't even want to bring up what's going on
exactly.
down south, but I believe in the system. I believe in the people. I believe people will come together at the table and realize that that really community pharmacies, they have really amazing places where people can just walk in. We're taking care of people, use the systems that they have. It's been working for years. It's just a well-oiled machine.
Yeah.
And tap into it. And I think we'll really be able to bring even more solutions. And isn't it, it's like, to be able to go to a convenient place that, the hours are good and you have such a well qualified healthcare professional and using people to their full scope and, valuing them, acknowledging them,
Yeah.
and really letting them, helping them help Canadians, British Columbians, I think is so important. So
Yeah.
I think we'll be in a better position. I think they'll work through these things. I trust in that. I think in the meantime, what I recommend is that if you call a pharmacy, your own pharmacy, if they say, you know what, we don't have the supply, but it's coming in,
Yeah.
and you feel like you really want the shot, the flu vaccine, sooner, you can call other pharmacies. And it's hard to predict, like who has it, who doesn't. It just depends, because it depends on what was given to that pharmacy
Yeah.
at that time. And I think it's too bad that we have to do this extra work to try to find find who has a vaccine. It's too bad that patients have to do that, but right now that's the workarounds that we have.
Yeah.
I think we work with it, and I think we can learn from this and make sure we do a better job. Let's use the pharmacy system, distribution system, to get COVID-19 vaccine to people, so people don't have to worry about what's going on behind the
Yeah.
scenes.
And I guess that's a great way to bookend this conversation is, at a time when we didn't, the pandemic just sort of arrived on our doorstep and it was all hands on at the battle stations. well, now we have some experience dealing with it, and we know what we need to do in pharmacy to keep patients like myself and pharmacists like you safe while they're doing their job and receiving their care. And highlighting this distribution system that you pharmacists and pharmacies have across the country as a way of really best serving patients' needs for COVID-19 vaccine, I think is a really important way maybe to end our conversation.
Yeah.
I want to thank you so much, Parkash. You've just opened up our minds, our eyes to everything flu vaccine. We appreciate it very much. At the end, I'm saying this to our viewers, we will have a slide come up with some additional links that you can go to read more about the flu vaccine, about all things pharmacy and flu vaccine. So we encourage you to do that and learn more. Parkash, it's just always my pleasure to either be in your company and second best, be in a Zoom room with you. We really appreciate so much your time and expertise and your humanity, I want to say. I just think you're a most excellent human. And so thank you so much for being with us here on Arthritis at Home.
Oh, thank you, Cheryl.
Yeah, we'll see you soon.
Oh, for sure.
Bye, everyone. Thanks for tuning in.